Here we go. Hello, happy Friday, and welcome to our Friday webinar with Dr. Tom Tully. Welcome, Dr. Tully.
Well,
Dr.
welcome,
Tully's
Laura,
hat.
and welcome to all our attendees for this very festive Ask the Vet. And
Right.
yes, and Merry Christmas to all as we get started. And I really, truly wish that. And again, happy, healthy 2025. But we close out 2024 with our Christmas edition of Ask the Vet.
There
And
you go. So if you have any,
for that, I have this my hat, and it has all the answers right here in the top of the hat, and then the lights go off with when it's really working hard.
your antlers just want to really stay up instead of come down here.
That's right. I can hear the sleigh bells in the background.
Very nice, very nice. Now I'm just curious how do your birds react to that?
Yeah, well,
Some would be like toy, others be like, oh no.
yeah, some, better than others, but nonetheless, you don't want to disrupt or, make too much noise. But they probably like Christmas music as much as anybody, some more than others, better than others,
True. All right. Well, if you're just joining us, let us know where you're joining us from on the chat. Tell us, curious where everyone's from. Weather here in California, where I am, is absolutely not Christmassy at all. It's really gorgeous. I kind of want the colder weather at this point. And so I got see, I'm in the holiday spirit. I got my
yes, you are
mug here. So we're kind of, we are advancing straight forward into the holiday season. So see if we have any.
It is.
Holiday questions. Okay. Oh, and if you do have a question, use the Q&A button and not the chat feature. And yeah, let's see. So wait, is there any pre-planning heading into the holidays, Dr. Tully, that you have for advice for people? Like, one, make sure you don't do anything that causes your bird to have to go to the ER or like emergency care. So be ready. Like, holidays are a crazy time of the year as far as availability of vets and places, and so.
Yeah, and then that's with the advent of the emergency clinic. At least most areas have emergency clinics, and just be aware of the ones that would see birds. That's main, and then you can always ask your regular veterinarian that what emergency clinic they use, and if they see birds, they would know one that would be able to treat that. And there's communication between your the veterinarian you routinely use for your birds and the emergency clinic to deal with that. So that's always something to kind of be preemptive, and then also be knowledgeable in case something does happen. And with our avian patients, and and people in general, you usually get sick or feel bad about Friday afternoon at 5, and then it always happens that way, and it never happens on Monday morning. And that's somewhat similar with animals. If it can happen, it will happen. The one thing is that with birds, and people have relatives over, friends over, just be aware that if you do have a bird, anybody that does have birds knows this, that birds are magnets. Birds are magnets for people that come visit. It's like, oh, look at the pretty bird. Does it talk? What, I mean, it's something that is they're inquisitive, just as what made you have an interest in birds and love birds. The people have that, and so they want to stick their finger in the cage and pet it, or and that may not be the best, and the bird may not like that. And so you have to be somewhat careful and kind of keep that in mind, because the first thing that they're going to go to in the house, if you have a bird, is to the bird.
That's right.
And if it's interactive, you can take it out and they can handle it. That's great. Like my little Senegal, I could take it out and then anybody can help it. My Derbian, well, that's a whole different story. It's like, just stay away.
Yeah.
But it is a stressful situation for the birds. If there's people staying over, it's out of the routine. And so you just want to be aware of that. And also, you're not going to be watching it because you're going to be interacting and visiting and talking and stuff. There's children around. Oh, look, it's
Yeah.
it's Peppermint Bark, by Ghirardelli, and it's great. But the children may say, oh, well, doesn't a little bug want one too, and so next thing you know, they're feeding it nuts and
Candy canes.
anything, candy canes and everything else. So just be cognizant of that, and just be prepared, because they are generally the star of the show when people come over. And most of you are aware of that because it's happened before, but just a little reminder.
All right, there you go. There's our holiday PSA.
Yeah, tip for the holiday season.
Okay. So we have our first vet question for today's episode, and that is about adopted an umbrella cockatoo 12 years ago with chronic prolapse. She's about 30 and has had 3 unsuccessful procedures to keep the cloaca in place. She sometimes regurgitates / throws up mucus, clear liquid. Not sure why. Also, we offer her food she doesn't like. She gags. So she's underweight and a very fussy eater. So thoughts about the mucus and yeah.
So yeah, it seems like 30-year-old cockatoo that has chronic cloacal prolapse. And what is a male, female? I don't know if
I think it's a she. Yeah, a female.
A female.
Yeah.
And so we're not going to really dwell on the length of time. We just know that it's happened over a period of time, and then there's been 3 attempts from different, I guess, different techniques, or maybe the similar technique that have been tried to keep it in. Okay, that's what I'm getting from this. Also, the bird is a picky eater, and then also the bird has this. It kind of regurgitates some, and so the cloacal prolapse doesn't necessarily correlate to the picky eating, and the each one could be a separate, or the mucus or the regurgitation, each one could be a separate entity, or a separate problem that's caused by each one a different thing. And they don't necessarily all connect. Okay, where some things can. You can have 3 different presentations and they all are related to one thing. So you have an upper GI problem, and then you have a lower GI problem and a gastrointestinal tract. And then you have this this picky eating. I guess the one thing with the we'll just address the eating issue. Not sure again, what the diet is, but this is something that will just is a something that needs to just be worked on to try to find what the bird will eat. and then work from there. Obviously, if it's a picky eater, then there are certain things that the bird likes that the owner would be aware of, and then you work from there to try to determine how you can find similar items that and to expand the bird's dietary offering. And that goes from things from of course, pellets, different types of pellets. You can start with different nutriberries. Nutriberries, again, are one of the things that, as Dr. Lafeber likes to say, is a complete diet. You could just feed nutriberries, whereas a lot of people see them as part of a treat or just providing a few. But if the bird only ate nutriberries, then it would be getting a complete diet. Okay, so that's one avenue, and then also you have the foraging aspect of nutriberries. But just eating that, then the bird would be able to you could possibly you can go across, and you can follow that with pellets, because it is a kind of a compact dietary offering, nutriberries are, and that the bird would be more amenable to eating a pellet. But and that goes for seed mixes, things of this nature, as you would be offering that. So that's something. It's just a kind of a work in progress. You know where you are now, but again, cockatoos can be very picky, more so in my mind than other birds, other parrot type species, citizen species, and the fact that we have a lot of cockatoos that are adult, and if we have to tube feed them, feed these birds, tube feed or syringe feed as an adult, they will kind of revert back to, hey, all I want to do is just feed me, So cockatoos seem to, in my experience, do that more than other birds. So it's not surprising that it's a picky eater, but at the same time, I would make sure that you weigh the bird and monitor the bird's body condition by checking the pectoral muscles or the chest muscles on this bird to make sure that that they are, I guess, you have a pectoral muscles that are filled out. Okay, good body condition, whereas that they would be more toward and thinner toward the keel, and that would be poor body condition. So checking the weight is really something. Is it increasing, decreasing? And of course, if you have this chronic prolapse, that's a stressful situation, and that would again, the bird's not feeling well with that, and that would play a part in the bird not really being in a general overall condition that's conducive to optimum health and body condition. Okay, so that's kind of, it's a drain on the bird. Now you have this mucus, and you say that it's regurgitating some. Now with this mucus, it's one of the things is to see, again, that's where we look, and is there an inflammation going on? That's where you look in the crop. You take samples to look and see what kind of organisms are in the crop. Look at the crop health. This is very helpful in trying to find out if there is an underlying cause, which could be bacterial infection. That could be an underlying cause. Sometimes regurgitation is associated with metal toxicity. If the bird has not had x-rays, radiographic images of the body and the stomach, then that would be helpful to see, oh my goodness gracious, it swallowed part of a zipper, it swallowed part of a car or something like that, one of these digassed Hot Wheels cars. I mean, I'm just thinking off the top of my head what we've seen cockatoos chew up and end up with zinc toxicity, and that's one of the things that is the will cause kind of a mucus regurgitation. As I mentioned, bacterial, yeast infections. Usually you have a smell with that. You shouldn't have any adverse smell with birds. Anybody that's been close and have smelled, it should not have an adverse smell to the if the bird's beak is open. But if it does, then usually that's indicative of an upper GI issue. So we talked about infectious organisms. We talked about zinc toxicity. Then also there's the possibility of you can look at this and you can have an infectious process, but then there's cancer. And that's probably lower on the list, but if it continues to happen and you can't seem to, and there's no response to treatment, you may get a little treatment response so that it comes back. That's when you have to look at doing CT imaging and with contrast, because stomach cancer in birds usually isn't like a big mass. It's kind of affects in the wall of the stomach, and it's hard to see on traditional radiographs or x-rays, typical x-rays that everybody's familiar with. So you have to do CT imaging with contrast to try to enhance that tissue, to try to highlight that abnormal tissue. So that's another possibility for that. But that goes through, like I said, routine diagnostics where you're looking at diagnostic testing, the complete blood count, cytology, or looking at the cells and the organisms through a sample of the crop, and the and then also culture if you possibly see organisms. Now, then we get to the again, all of this is trying to condense everything down into the Ask the Vet time frame, but this is all considerations for these problematic issues, and this is what's going through our heads when you bring in the bird. We have to have all of these considerations, and we go from what's the most likely to not. Now, when you look at the cloacal prolapse, usually what we found is that that's more hormonal. And so it's very difficult to address the hormonal issue, especially if you have a female. And then it's the treatment of choice is removing the ovary. But again, removing the ovary is extremely a risky surgery, and there's no room for error, and very few veterinary surgeons can do that, or will even attempt to do that, because of the ovaries, just like a piece of wet tissue paper thrown at the front of the kidney, and it's very I guess it's indistinct as far as the delineation of the kidney. I mean the gonad, where meaning if you have a testicle at the same location, it's gonna, and people say, well, it looks like a tic tac. It looks like a little breath mint, tic tac breath mint. Okay, or a little black-eyed pea, or a little pea. But it's white, and in white cockatoos, it can be dark or black. But nonetheless, that's where it's located. So it's very well defined. Whereas the ovary is just like a mass of tissue that's up against the front of the kidney, and there's a lot of vessels with names that are right by the aorta, and that if you happen to the vessel around there, you don't ligate it or prevent it from bleeding enough, then that can be fatal. So trying to do what's needed to be done, there's very few people in the world that would be willing to do that with the risk involved. So therefore, since it's in most cases, not all, but with cockatoos in particular, that's the most common reason. There can be other things that are associated with it, parasites in the lower causing increased motility of the GI, and then you have bacterial infections in that lower GI that increase the motility, and anything that causes that GI tract to be irritated, inflamed, and moving, it's going to the cloaca can prolapse. But hormonal is the most common in general for cockatoos. And so what happens is that there's a number of procedures that you can use. I mean, you can perform to try to keep it in place, but all you're doing is, and what we're doing is keeping it in place. We'll put a suture around the vent opening and cinch it up, and then, like, you're not coming out. Well, you want to make sure that there's a fine line between too tight and not tight enough, because that cockatoo is going to continue to strain and strain and strain. It's going to strain all the time because you're not fixing the underlying problem, but you're keeping it in. Now, if you did tie, you tie that suture too tight, or you put two little sutures on each side, and it's and the tissues not allowing it to defecate, well, it'll fill up with fecal material and become toxic. Okay, and if it's not tight enough, well, you'll have the sutures in there, and boop, there it goes again. And so you can do a surgery, you can open up the bird, and you can cinch up that cloaca to the ribs, and cloacal pexy, and that'll keep it in. But remember, it's still straining, and then what is going to happen to that suture? Well, it may last 6 months, it may last a year, it may last a month, it may last 2 years, but I can guarantee it'll eventually break down, because that tissue is getting, pulled and weaker and weaker and weaker until it breaks. And now there's also cloacoplasty, where you actually take out part of the cloacal, and that's possibly, and there was a newer technique that was described about 4 or 5 years ago, to take out part of that cloaca, the vent opening, to keep it in, and that's more permanent and seems to be most effective. But eventually that's likely to break down, because again, it's straining and straining and straining, and the tissue's going to again get weaker and stretch and stretch and stretch. So the key is, just like any disease process, you can take care of the problem, you can stop the coughing, but if you don't treat what's causing the coughing, you're not going to get any better. Okay, because you have to treat what's causing the problem, not just treat the problem. You see, that's the key. And in this situation, that's why you can continue, and you've had it 3 times and you still have a prolapse. You can try it 3 more times, 10 more times, it'll still reprolapse. No, unless you take care of the underlying problem. One thing you can try, the hormonal implants, the desmorelin implants, was one thing, but they're not cheap. Okay, I say, let's just say they're between $200 and $300 for an implant. We really don't know how long they last. We don't know if it'll work. It may last 2 weeks. It may last a month. It may reduce that bird's straining. May be effective, but it's very disheartening and disappointing if I pay $300 or $200 for an implant, and in 3 weeks I'm back where I started. And so there's no guarantees with the implants, but that is something to see if in fact it worked. Unfortunately, we don't have a simple procedure at this point to just go in and remove the ovary, which would, in most cases, would take care of the problem. But that's kind of it in a nutshell on those 3 very real problems. And like I said, as you see with the possible diagnosing, with the possible treatment, that they're not necessarily correlated in any way, or not correlated, but individually they're very what I say, difficult in a sense to identify and treat. But there are plans, and you have to follow the process. And in many cases, we do get to the cause. It's just the resolution can be elusive in many of these cases. So great question to start off, and so thank you.
Okay, we got a question about a 9-year-old female cockatiel. So they say a few years ago she suffered hypocalcemia.
Yeah, hypocalcemia, low calcium,
From
low
chronic
calcium.
egg laying. So it caused paralysis of the leg, and she was treated and got on Lupron, and is doing quite well now. But she still favors her leg a bit and leans on it. Because of this, it is sore, and is best to use a Silvadene cream long term, or what kind of ointment or treatments to prevent pressure injury. So still favoring the leg. So what kind of ointments or treatments do you recommend for prevent a pressure injury?
Okay, this is an interesting question. So we have a little cockatiel here, and a number of years ago, it had low calcium level that was diagnosed, and with that low calcium level, there may have been fracture because there wasn't enough calcium in the bone, and that resulted in a weak bone in the leg or joint that caused an injury, a fracture for one. And this fracture or injury to the bone resulted in a permanent lameness. Okay, and so and then we'll get situations where there's older cockatiels may not even have a hypocalcemic situation where they have a normal calcium levels, they're getting adequate calcium in their diets, but they still are hock setters, okay, where they sit on the hock or their ankle, okay? And so when it sits on the ankle, that will cause, or perches on the ankle, that will cause pressure on the skin, on that ankle as it touches where it rests on the perch or the platform, whatever, and that results in ulceration of that. And so so I'm just going what it kind of normally occurs or can occur, and it seems like this is what the person that's asking the question is referring to. Now, Silvadene cream is an you know it's anti bacterial. I mean, it's um, um, you know, it's a cream. It's not an antibiotic cream, but what it does is that it is a kind of a cream that is really really looks to treat to prevent infectious infections from occurring in the exposed tissue, and it has silver in it. So that's the treatment to really is an anti-bacterial growth kind of inhibitor that is used, but it's not an antibiotic. So this is what silver-sulfadiazine is. And it's kind of a white cream, and we use that quite often. So this is like you wouldn't use the cream to prevent a an injury, but it is really used to treat an open area to reduce the incidence of infection. So what that would mean is that if you're using that there would be an ulceration. Now, what we've we've done on some of these cockatiels, if it's ulcerated, is that for the most part, these ulcers on the lower leg really don't heal well. They don't heal well at all. And so what we'll have to do is go and really around the edge of that ulcer is, really delicately trim that edge of the ulcer, and then use very small suture and suture that closed if there's no infection in there. And so we know that in 10 to 14 days that will be healed. Now, we want to prevent that from occurring. So there's two things that you can do. Now, naturally, you're not going to be able to really change the bird's general posture or positioning of the leg, because that has been altered due to the original hypocalcemia and the injury that was sustained during that time. And so what you look at is trying to prevent or reduce the pressure on that area that's touching the surface of the perches or platforms. So one is to have perches or platforms, see where the bird normally goes and is most of the time, and make that pad that in some way with some type of a softer, some type of a tape. And I'm thinking of what we call vet wrap, or something that you can wrap around that perch to make it where it's padded in a sense. I'm just going to put that in quotations, but something that'll make it padded. Or you can make little like knee pads, reverse knee pads for the little cockatiel on that leg, And that's something that if you're going to treat birds or companion exotic species in general, and then you go even on a bigger picture to veterinary medicine, you have to be innovative. You have to be innovative because they don't make reverse knee pads for birds that I can go on Amazon and order. Especially cockatiels. Oh, there's the cockatiel reverse knee pads, and that's what I need today. Oh, they're going to be shipped by tomorrow. I know that's not going to happen. So we have to be innovative and come up with an idea. I have it in my mind. I would give it a go to make it, but and how well, and you have to modify it, whatever. We do that all the time. To treat birds, you have to be innovative and you have to think out of the box because there's no box you can pull it out of, And so this is what we're looking at for something like this, healing that area, and that is if it's ulcerated, it's usually what we call delayed primary intention closure, where you clean it up, it's not infected, you freshen up the edges, and then you suture that up, and it's going to be healed in 10 to 14 days. And we have a little cockatiel that we treated for that about, no, I guess about 7, 8 years ago. The owner flies the cockatiel every night. It's free flight, does his exercise. It's 27 years old. And so it had a little issue, and we had to do this exact same procedure. And really, we checked that out since we did it about 7, 8 years ago. And it has, and he's doing well. The bird's doing well, as well as a 27-year-old can, but he gets his exercise every night. So, so there you go. Great question. And this is not uncommon. And it doesn't only happen in cockatiels, it happens in other birds, but that's how we have to look at it. Heal what's ulcerated, and then where is this occurring? And then if you can work on the padding, that may be helpful either on the bird or where it's purchased. Yeah.
Okay. All right. I got a tricky word I got to pronounce here. So bear with me. Okay. Dr. Tully, please, could you talk about panocartoma? Time panocartoma. Sorry, I'm slaying the words. Orange-wing Amazon has one in his left ear. Is it true he feels no pain? Will he eventually die from the condition as the keratinous substance works its way through into his brain? I get his ear scraped out every few months. Of course, he can't get it all, and it just keeps producing the rock hard substance. So,
okay.
did I say the word right? Because
let me. So it ends with an OMA, right? OMA.
So it's TYMPANOK. Yeah, keratoma. Keratoma. So with a KERATOMA.
Okay. Uh, let's see that. Let's see that again, Brenda. I think she put something up there. I don't know.
Yeah, if you can you see that in the
Yeah, I did see it pop up, but I a
yeah,
tympanokeratoma, a tympanokeratoma. Okay, tympanum.
yeah.
Tympanum is basically the eardrum. Okay, that's the eardrum. Tympanum. Keratin is the kind of the cells. As the is the kind of the outer layer of cells. that's within the ear canal. So an oma is, and this is just basic, and then basic distribute. And when it says it's a cyst in the middle ear canal, well, an oma, it can be a cyst, but it also can be a neoplastic tissue, which is kind of a cancerous tissue. But it can be non-malignant, and on that it can be a benign neoplastic tissue. But nonetheless, if you don't remove it, it keeps getting it keeps growing. So you remove part of it, and that's when we're talking about neoplastic tissue, you're talking about, of course, malignant. It continues to grow and it spreads to other parts of the body. And then you have benign, which is some benign tumors can be life-threatening. Oh, I have a benign brain tumor. I guess it's better than malignant, but who wants a benign brain tumor, right? So it could be life-threatening. And then you can have benign tumors like, well, you have a keratin producing tumor. We had a keratin producing squamous cell carcinoma in a macaw that was on the lateral aspect of the body that underwent 6 radiation treatments recently, and responded to that. This is one of the things that when you have something like this, that you look at this tissue and identify it. And within the ear canal of birds, and everybody who has a bird, is kind of familiar with where the ears are. They're really below. If you look at the lateral aspect of the eye, they're going to be behind the eyes and down a little bit. And sometimes you'll know where the ears are because there's a little bit of a different architecture to the feathers over where the ears are. And if you pull that back, you can see the little ear canal. There may be a little flap of skin that's kind of covers it a little bit, and others it's not. But for the most part, we don't have any problems with ears in birds, but we can have infections. We can have these, what if you have a tympanokeratoma, then possibly a neoplastic tissue, or kind of a cancerous tissue, and that can be cyst-like, kind of dealing with something similar in a ferret, but it's not in the ear canal. It's a different part of the body, but it's somewhat similar in the description of what it is, and it produces fluid. Okay. And so this is in the ear canal, and it's very difficult to treat and get down to the base. If you're thinking of think about, oh, well, I have say for ease of sake, I have a tumor that causes a cyst on my eardrum. Well, let's go in the ear canal. Well, gosh, it's way down there, and it's hard to see. And can you imagine trying to remove that tumor intact and get clean borders where all the tissue surrounding that tumor is normal? Very difficult. And that's the same thing, and it's even on a more of a magnitude of difficulty when you're looking at a bird, because of the size of the ear canal and the depth of the ear canal and trying to remove it. So when you're looking at something like this, you can only kind of remove the easy part, but you'll never get to the rut or the root of the tumor. And so I'm back, here I am. And it's frustrating for you, and even more frustrating for the doctor who's treating the bird, because it's what next, because it's kind of a Groundhog Day. We've been here before, we're here again. you know, and it's just like, and I know that's frustrating for you as the bird owner. So the question is what can you do? And which is why it's a great question, right? Not offering much there so far, but just giving you an idea of what we're up against on something like this. And so one the bright side is that it's kind of localized to that area, and but it can expand, and it's problematic, you know, that it bothers the birds. It's going to be difficult to cut it out and get clean borders. So one of the things that I would recommend is talking to an oncologist. We have if we have diagnosed a tumor in any of our birds, we you know, we're fortunate here to have the oncology service right next door. So I can talk to the radiation oncologist, I can talk to the medical oncologist, and I say, what do we have here? And so and then they can say, oh, well, something like this, we can do radiation oncology, and so we can treat it in the, you can debulk it. We call it debulking. And so that's what removing, you know, the top part, but then that gives you a better chance of really treating the root with the radiation therapy. And then again, we're dealing with the head, you know, and this is where the oncologists have the knowledge on how to treat and what the best treatment is to give the best chance of resolution. However, everybody on the webinar, I will tell you that birds do get cancer, and anytime we go to the oncologist, you know, there's very minimal scientific evidence or you know, on how to treat a specific species, you know, or a specific tumor in a bird. And so many times the recommendations by the oncologist are based on other animals or one or two reports, which is not, you know, kind of validated, but it does give them an idea where to go. So that's where we hope, and then we, you know, depending on what type of treatment, we have to follow up, because a lot of this, the treatment that we use is may affect whether it's chemotherapy or whether it's radiation therapy, more so with chemotherapy, to make sure that we don't kill off the blood, the bone marrow, so you have you don't become the patient doesn't become anemic or have low white blood cells. And but the oncologist, that's the one thing that I want to mention, and which is good about this question, right, is when you're talking about treatment of birds with cancer, that often you have excellent oncologists that's going to give what they feel is the best treatment options, but sometimes the birds don't respond well. All of a sudden, we give it chemotherapy, and the bird becomes very anemic, or it wipes out the blood cells, so they don't have any way to fight disease. This is something that's common in humans. And the reason that it does that is because the blood cells are rapidly dividing cells. And what does the chemotherapy target? Rapidly dividing cells. That's cancer cells. And so it doesn't discriminate between, oh, well, you're a good blood cell and you're rapidly dividing, so I'm not gonna kill you. I'm just gonna kill the cancer cells. Let me go to the cancer cell and have a good day. No, it's like, oh, you're rapidly dividing. I'm going to kill you. And then so it kills the blood cells, and then it kills the cancer cells. And that's what we have to think about when we're treating. But this case with the tympanokeratoma, that I think the oncologist would have an idea of what the best treatment is, or whether it's effective or not. Whether it would be how effective treatment would be and which one would be best to try to resolve it. And I think that's going to be your best bet to try to give the bird the best chance of having a recovery on this. Otherwise, it's going to be what you've been going through up to this point. And sometimes cancer treatment, we had a cockatoo that had a growth that wasn't cancer, but it was just tissue that was growing kind of out of the beak due to a traumatic episode, and we kept trimming it back and sending it off for biopsies. Then it wasn't cancer; it was just kind of kind of proliferative inflammatory tissue. And it was soft, and it was just like a mass coming out of the beak. It wasn't cancer, but it was, as I mentioned, proliferative tissue. And we actually used radiation therapy on that to treat that case. And so oncologists are very useful. And when we get into that situation where we have frustration and the treatment isn't working, then that's who we need to contact, especially if it's neoplastic or new tissue that may be kind of a cancer in origin. Yeah, benign omas, but none, the tissue is kind of cyst-like. New tissue, neoplastic tissue. Yeah.
Okay.
I hope that is helpful. Yeah, but it's a good question, and it touches on some bases I don't think we've talked about too much, but you get to, and like I said, it's a process, and we talked about it earlier in the Ask the Vet about you go through a process. It's not like, oh, well, let's talk with the oncologist. Initially, that is you try to do. Oh, let's just remove it, and that may resolve it. Then you identify it. Everything's there. That's what the oncologists need. They need to identify what it is. And then there's stages. And people have heard, well, I'm at stage 4 this or stage 3 that. And of course, the higher you go into stages, the worse it is, more extensive it is. But in this case, the oncologists know what type of tumor it is, and then they can figure out what's best for it. Yeah.
Okay, and then let's see, question. Okay, so any proof that apple cider vinegar has any effect on preventing flare-ups of avian gastric yeast? So apple cider vinegar and avian gastric yeast.
Not that I'm aware of. Not that I'm aware of. I learn something new every day, but no, not that I'm aware of.
Would it be harmful?
That's a good question, but I haven't, the one thing about apple cider vinegar, it's like diatomaceous earth. It's, I've been hearing about diatomaceous earth ever since I've graduated vet school. We didn't have a course in diatomaceous earth in vet school. You may have it if you take geology in the undergraduate. And so the thing is that it's been promoted and as it's a good it's being promoted as, being very good at, how should I say it? It's kind of a cure-all type thing. If you need it for anything about the bird, it's just it treats anything. It's like um, you know like some kind of a tonic. Here, give it to this, and it'll cure what ails you. And so, that's the way that kind of the diatomaceous earth, it'll prevent any type of parasite. It'll do everything that you want it to do. And that's kind of apple cider vinegar is kind of the same thing. Now, I haven't had any birds come in with that apple cider vinegar toxicity or what have you, and I'm sure that that it's effective in some things, but I haven't really in treating birds for a number of years, and seeing birds, what have you. I don't think that is something that would make a difference one way or the other. I don't think it's going to hurt the birds that I've heard. So it's one of those things. If it's not hurting the birds, then and you think it works, then there you go. I mean, then say, oh well, that guy in the funny hat doesn't know what he's talking about. And so, um, good, good. If you're happy, I'm happy. But I don't think it's going to make a big difference one way or the other. You provide a good, clean environment. You provide good nutrition, and provide an environment that's conducive to a happy bird, and then that's what you're looking for, and that's going to take you a long way on that. Yeah.
Okay.
But thank you. Great question. Yeah.
Yeah. Okay.
And
Well, that was.
well,
That's
I was just going to say that there's medications that doctors use. I was looking at an article in USA Today the other day, and that gabapentin, and some of you may have have heard of gabapentin, but it was talking about gabapentin being prescribed in humans, and gabapentin it was kind of is a drug that affects the calcium channels, and we're getting down into some medical physiology and anatomy and in the nerves, and it was originally developed for seizure activity, epilepsy. Okay. And so it was originally developed and approved for treating epilepsy. And this USA Today article, you could go look it up online, and they were talking to physicians where gabapentin now is for physicians being prescribed for anything, neurologic problem. Oh, gabapentin, this, and really there's no evidence that it's effective, but it affects the nerve, and it works on these calcium channels. Don't know everything that it does or how it works totally, but nonetheless, that's it's kind of being prescribed for everything. Well, it's a little lame. We have a little thing here. Well, let's give it gabapentin. And so that's somewhat similar in veterinary medicine. Gabapentin's kind of the drug du jour. Does it work? We don't, there's a question about how it works and why it works, but it's being prescribed for a lot of different things, and it's not necessarily correlated to the knowledge of how it and why it works. So, we talk about apple cider vinegar on one side, we're talking about gabapentin, and there's other drugs like that. And we haven't had any really overdoses, but sometimes people say it works, and does it? I'm not sure if it works or it's what else we're all doing. Is apple cider vinegar working? Well, think about everything else you're doing to make the environment and the nutrition good for the bird. So there you go. Yeah.
All right.
Thank you.
All right. Well, good. Well, that was our hour. Can you make, oh, and I just wanted to, we did not acknowledge this.
I mean, Laura, we're in a time warp. We just started.
I know, I know. What's even crazier is we forgot to mention this the last time we were on with you. That was our 50th episode with you. This is our 51st episode. So
really?
You have,
oh, well,
correct me if I'm wrong, Brenda, but I think,
50.
yeah, I think this is like I think it's our 51st time on with you. So that's yeah.
Well, thank you, Lafeber, and most of all the attendees for these excellent questions. All we do is hope that it's helpful. It's helpful for me. I enjoy it, and I look forward to 50 more. And because we touch, it's been 50 episodes, and there's always something new. Always something new. How many times have we talked about a tympanokeratoma?
I didn't even know how to say it. So yeah.
Yeah, there you go. That's what I'm saying. My goodness gracious, on our 51st.
Yes. Yes. And yeah. So there we go. Something to keep in mind when you head into 2025.
My lights went off when you mentioned that. I didn't know if you saw that.
Oh, I missed it. Okay, I gotta announce today's giveaway winner before, which is going out to Ron Britton. Congratulations, Ron. You're gonna get some pumpkin spice berries, as well as another Lafeber product of your bird's choosing.
Merry Christmas.
No, just in time for the holidays. And then I was gonna remind everybody. So next Friday is the big one. Next Friday is the holiday. That's where Lisa Bono is going to join us, another year of the giveaway, where she's going to go through all the great holiday, or not just all the great products for your bird, as well as we're going to be giving so much away, so many great items next Friday. You have to join us. It's going to be starting early, so we have an earlier start at 11 because we want to make sure we get through everything. She has a lot to cover. We have a lot of generous people, companies that have donated products to give away, and yeah, so you got to be there to win it. So join us next Friday starting at 11 a.m. We'll be doing our holiday giveaway. So yeah, that's
fantastic.
Right.
Yes, don't miss it.
Do not miss it. You do not want to miss this. So there we go. All right, guys, on that note, Dr. Tully, always a pleasure to have you on.
Yes.
Wishing you happy holidays, and I'm just gonna imagine you wearing that hat up until like next week.
How do you think Santa finds my house?
There you go.
He looks for the lights. But thank you so much, Laura, Brenda, Lafeber, and most of all of our attendees. And I know we have attendees that tune in from all over the world. And I just want to wish whatever holiday that you are and festive occasion that you're celebrating during this time as we close out 2024, have a happy, joyous one, and then also a happy, healthy 2025. Thank you.
There we go. There we go. All right, guys. On that note, I wish everyone a wonderful weekend. All the best for you and your flock. Till next time, stay safe. Bye.
Bye.